This is the radiographic image analysis for the cranium mandible. We'll be looking specifically at the PA and AP projection as it relates to the anatomical structures of the cranium and mandible. Let's quickly review our cranial positioning lines and landmarks. We know that the acanthion is the point on the mid-sagittal plane where the nose and the upper lip meet, okay? The acanthion forms the acanthion meatal line, which we will utilize in our positioning. The external auditory meatus, we know that's the external ear canal opening. The glabella is at the level of the eyebrows on the MSP. The nasion is on the mid-sagittal plane at the level of the eyes. It's the depression at the bridge of the nose. The outer canthus is where the top and the bottom eyelids meet laterally, or the outer corner of the eye. Our cranial positioning lines that we utilize in head work is the infraorbital meatal line. It's the line connecting the inferior orbital margin to the EAM. The interpupillary line, the line connecting the outer corners of the eyelids. This book has the lips meatal line, but Merrill's will refer to it as the acanthia meatal line. Mentomeatal line, which is the line connecting the chin to the EAM, and the orbital meatal line, which is the line connecting that outer canthus, that outer corner of the eyelid, to the EAM. This line is approximately 7 to 8 degrees superior to the infraorbital meatal line. So let's review the image analysis guidelines for the cranium and mandible PA or AP projection. Image analysis guidelines for the cranium states that the distances from the lateral margin of the orbits to the lateral cranial cortices on both sides should be equal. The anterior clinoids and dorsum sellae for the cranium are seen superior to the ethmoid sinuses. The petrous ridges and supraorbital margins are superimposed, and the internal acoustic meatus are visualized horizontally through the center of the orbits. The supraorbital margins for the cranium are on the same horizontal plane. The dorsum sellae is at the center of the exposure field when taking a PA or AP projection of the cranium. And the outer cranial cortex and the maxillary sinuses are all included within the exposure field. In regards to positioning, we want to tuck the chin towards the chest until the OML is aligned perpendicular to the IR. You also want to center your central ray perpendicular to exit the glabella. Image analysis guidelines for the mandible AP-PA projection states that distances from the mandibular rami to the lateral cervical vertebra on both sides should be demonstrated as equal, and the width of the mandibular rami should be demonstrated symmetrical. The mandibular condylar processes are visualized through the mastoid processes, and the mandibular rami should be seen without foreshortening. The mouth should be closed with the teeth together. The TMJs should be demonstrated on the same horizontal plane. A point midway between the mandibular rami should be at the center of the exposure field, and the entire mandible is included within the exposure field. For both projections, whether you're imaging the cranium or the mandible, you should have the bony nasal septum aligned with the long axis of the exposure field. When positioning for the mandible, we still want that OML aligned perpendicular to the IR. However, our central ray will exit the acanthion rather than the glabella. I have included those image analysis guidelines for you here. When positioning for a PA projection, you want to ensure that there is no rotation in your cranium image. In order to accomplish this, we must position the cranium so that the mid-sagittal plane is perpendicular to the IR. To prevent this rotation, you should take both hands and place them on the sides of the head or the parietal bone and adjust them so that your hands are perpendicular to the IR and yet parallel to each other. So cranium rotation is identified in two ways. The first way is if the distance from the lateral margins of the orbit to the lateral cranial cortices on one side is greater than the other. Okay, so you can see in this image that the right side has a bigger distance from the cranial cortice to the lateral margin than on the left. This should indicate to you that we are rotated towards the left. And the reason why is because the face will be demonstrated as rotated away from the side, demonstrating the greater distance. A secondary way to identify rotation is the distance from the crista galli to the lateral cranial cortex. Again, there will be a greater distance from one side rather than the other. However, it is much more clearly identifiable to utilize the lateral margins of the orbit and the lateral cranial cortices. Let's take a look at OML alignment. Now, when positioning the OML perpendicular to the IR, this moves the orbits inferiorly until the supraorbital margins are situated beneath the petrous ridges and places the petrous pyramids and internal acoustic meatus within the orbits. Poor alignment of the OML is detected by utilizing or evaluating the relationship of the petrous ridges and the supraorbital margin. With insufficient chin tucking, the petrous ridges are demonstrated inferior to the supraorbital margins. The internal acoustic meatus is obscured by the infraorbital margins, and the dorsum sellae and anterior clinoids are demonstrated within the ethmoid sinuses. If we flip back, you can see that the petrous ridges are just inferior to the supraorbital margins here, okay? And here's your petrous ridge and supraorbital margin. So therefore, they should not be demonstrated so inferior to, okay? So you should know then that your OML is not perpendicular with the IR, and we need to repeat this image if it is not within evaluation criteria. So again, we are going to utilize the relationship of the petrous ridges and the supraorbital margin to determine if this OML alignment is sufficient. This image is a demonstration of excessive chin tucking. This throws the petrous ridges superior to the supraorbital margins. The internal acoustic meatus is obscured. The dorsum sellae and anterior clinoids are visualized superior to the ethmoid sinuses. So let's take a look at rotation in a PA projection of the mandible. To identify rotation, you're going to take a look at the relationship of the mandibular rami to the lateral cervical vertebra. If the distance from the mandibular rami to the lateral cervical vertebra is greater on one side than the other, then you have some rotation. The mandibular ramus demonstrating the least width will indicate the side the face was rotated towards. So in this case, the patient's head was rotated towards the right side because the width on the right side was less than on the left of the mandibular ramus. We can use the same relationship of the supraorbital margins and petrous ridges to identify poor alignment of the mandible, or the OML alignment, I'm sorry, for the mandible. In insufficient, we know that the petrous ridges will be demonstrated inferior to the supraorbital margins. Our mastoids will be obscured and the mandibular rami will be foreshortened. So we will have to repeat this and get that OML perpendicular to the IR in order to obtain a sufficient projection. Again, we're going to look at OML alignment when looking at our mandible projection to ensure that we appropriately align the patient. This is an example of excessive chin tuck which is poor OML alignment. We're going to look at that relationship of those petrous ridges, and in this case, they are demonstrated superior to the supraorbital margins. Your zygomas will be obscured or obscure the mandibular condyles, and the mandibular rami will be foreshortened in this projection. And in this projection, we've clipped the chin, so it's not the best, but it is an example of excessive chin tuck. We will conduct the image analysis practice together in part 2. Thank you.